Little Luxuries on Your Money, only on Money FM 89.3.
Remodel your look in less than half an hour. I've heard so much about this thing called Profilo. Welcome to Little Luxuries. Today, I want to look at what has been suggested as a bioremodeler. Now, what is that? It's an injectable. We all want to age gracefully, but I would like to find something that can wipe the sag away. So our little luxury today is Profilo, and that is used to treat skin laxity and also give patients who want to avoid synthetics another option to address issues like, droopy skin or poor hydration. But can it return a youthful glow without altering your features? I invited in today Dr. Lam Bilan to join me in Little Luxuries. How are you, Dr. Lam?
Good, Michelle. How are you? Thank you for inviting me to your talk show.
You are looking ageless as always.
Thank you.
All right. He's, after all, founder of Ageless Medical. Dr. Lam, help us understand what Profilo is to begin with.
Now, Michelle, Profilo is a Singapore Health Science Authority approved, as you mentioned, bioremodeling injectable skincare, and it addresses the skin issues of skin laxity, dehydrated skin, and poor skin quality, and signs of aging through the biostimulation of collagen, elastin, and fat cells in our skin that are lost as we age. Now, Profilo, it's launched in Italy in 2015 and brought to Singapore in September 2019. Until the end of last year, 2019, there are 1 million Profilo injections performed worldwide.
I've been reading about this in a lot of chat groups. It's all over Facebook in terms of the groups that I go to. And there's this term bandied around quite a bit, Dr. Lam, and that is bioremodeling. I like that. Absolutely. It sounds very futuristic. Go ahead and remodel my face. But what does bioremodeling really mean?
Now, as I mentioned earlier, now Profilo is a HA, and Profilo has some special characteristics in that it is made up of highly pure hyaluronic acid. It also contains one of the highest concentration of HA in the market at 64 milligram per 2 mils of the product. Profilo is also special in that it has combination of both high and low molecular weight HA. I go into all these at length because there's a reason. Now, recent studies have shown that the combination of HA of different lengths and different molecular weight, like in Profilo, have a synergistic effect in tissue repair and regeneration. And then we come to the word bioremodeling. Now, once Profilo is injected into the correct layer of the skin, and that's the superficial layer, the dermis layer of the skin, it is able to stimulate our skin to produce 4 types of collagen and elastin. And these are very, very vital substances in our skin that are lost when we age. And because it's able to stimulate the production of collagen and HA, is able to bio-remodel our skin and to improve the skin elasticity and improve the skin laxity.
Yeah. I mean, it's a real luxury for aging women to think that something exists that can help them without changing their look drastically.
Absolutely.
Right? I mean, how different is this, for example, from Botox?
Now, Botox or botulinum toxin injections, as we know, it acts by blocking a signal from the nerve to the muscle. And when the signal is blocked, the muscle cannot contract. When the muscle cannot contract, it will relax. And therefore, it will soften the expression lines, the sign 11 between your eyebrows, your crow's feet, your frontal point lines. So botulinum toxin injections are good to soften expression lines, but it doesn't improve skin hydration. It doesn't improve skin quality. It doesn't improve skin laxity like Profilo. That's the difference.
All right. So, people looking for something that'll moisturize their skin, but go beyond what moisturizers can do, people looking in the world of injectables, have come across names like Rejuven, for example. Now, I understand that's a skin booster. It can help with the healing of skin. So how is Profilo different from Rejuven, which was quite a craze?
Yeah, very good questions, Michelle. These are absolutely the questions and patients ask me when they come and visit me, because a lot of my patients have got skin booster injections and Rejuven. To set the record straight, skin boosters are also hyaluronic acids, okay? That means it can help to hydrate the skin. However, skin boosters are generally injected and delivered through multiple injection points on the full face, okay? All over the face, multiple injection points also into the dermis layer of the skin, and it therefore hydrate the skin. But Skin Booster does not improve skin laxity. It doesn't bioremodel the skin like Profhilo. Now, Rejuren, on the other hand, is PDRN, and Rejuren is derived from salmon sperm DNA. It is not HA. It is not a botulinum toxin. So Rejuren is meant, when it's injected into the skin, to stimulate our skin to produce collagen and HA also, but it acts to heal the skin of fine lines and wrinkles. It may help in some patients with acne scars, with eczema skin, because it balances the sebum and moisture production. But like Skin Boosters, Rejuren, we know, are injected through multiple injection points all over the face. So both Skin Boosters and Rejuren has downtime. It can be painful, and some patients can't take the pain. Whereas Profhilo, besides improving skin laxity, improving skin quality, and skin hydration, the beauty of it is that it's injected through very simple injection technique. 5 points on one side of the face, another 5 points on the other side of the face. So 10 points on the face, 10 points on the neck, and it can flow to the rest of the face, and it can hydrate, it can improve the skin laxity, it can improve the skin quality. And that's the difference between Rejuren, Skin Booster, and Profhilo. So Profhilo has got minimal downtime and also minimal discomfort.
Dr. Lam, where can it be used, Profhilo, besides the face? Because when you talk about skin laxity, you know, for some of us, a lot of other places are drooping as well.
Exactly, the turkey neck. Now, as mentioned earlier, so Profhilo improves, remember, skin quality, skin hydration, skin laxity. So in other words, in any parts of your body where your skin is dry, it is dehydrated, it has poor skin quality, and it is lax, you can use Profhilo. So as you mentioned, turkey neck, when the skin is lax, you can inject Profhilo, exactly. Skin at the back of the hands, your bye-bye arms, skin laxity, inner arms.
Oh, you can pull up chicken wings?
Yeah, you can improve the laxity, and it can also tighten the skin. And in my ladies with stretch marks, you know, post-pregnancy, Profhilo is actually very good for improving your skin laxity and hydration. And it can also be used to treat acne scars. So in other words, you apply what Profhilo can do to any parts of your skin that needs help. It's very straightforward.
A little tugging up.
Yes. Yeah.
Tugging up, but sort of naturally, the sort of baby skin, you know, people always say they want that baby skin shine, and they're referring to that laxity, the way the skin bounces back after you hit it, that you just can't get from a moisturizer. I mean,
exactly.
I tried, Lord knows.
But you already put it, Michelle, once you hit 35 to 40 years old, no amount of moisturizer is going to help you replace the moisture loss from your skin. We have to face it. You need some form of injectable skincare like Profhilo, or even Skin Booster, Rejuren, or whatever it is, whichever your doctor decide best suits your skin to help you improve the hydration.
So tell us about this little luxury. I like it, and I think it suits, the term little luxury, because you don't need to do this every 3 days, 4 days. You only need a couple of sessions a month apart. Is that right?
Absolutely. Now, the protocol for Profhilo, you require, the startup protocol is 2 to 3 sessions, 4 weeks apart. You mentioned it correctly. And thereafter, patients will repeat once every 6 months because the results after 2 to 3 sessions can last 6 months. In some patients, depending on the skin condition, if they are more mature skin type, really very dry and dehydrated, and they've never started any injectable till they reach 50s, 60s, where they need a lot of help, your doctor might suggest even 3 to 4 sessions. So at the end of the day, it is best that you visit your doctor who will assess the skin condition, visit your trusted and experienced doctor, and tell you how many sessions require in order to give you the optimal results from Profhilo. Generally 4 weeks apart between injections, because our skin renewal process takes about 28 days on average, and therefore you need the skin to renew and to regenerate before you start the next treatment session.
Okay, this sounds really good, but let's talk money. What's the average cost for Profhilo treatment?
Profhilo costs from $1,000 and above per sessions, depending on which areas of the face or the body is required and how many vials of Profhilo is needed. You will, at the end of the day, need to visit your doctor, and then they will assess and discuss with you how many sessions are required and the cost of the treatment.
Okay, well, thank you for telling me more about this. As I said, I've seen it talked about, bandied about, and I wanted to know how this works to in terms of giving us back a youthful glow. She's Dr. Lam Bilan, Ageless Medical founder, looking ageless as always. Thank you, Dr. Lam.
Thank you, Michelle.